Hello there. Thanks for tuning in to the Highmark Health Options Health Awareness Series. We're glad you're here. Today we're going to talk about diabetes, specifically current monitoring technology. This is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your doctor or other qualified health provider with any questions or concerns you have about your health. Here are the topics we will cover. What diabetes monitoring technology is available? What does Highmark Health Options cover? Let's go ahead and get started. So what diabetes monitoring technology is available? Managing and monitoring your diabetes has come a long way. From blood glucose meters and continuous glucose monitoring to cutting-edge insulin pumps and more, devices are easier to use and less invasive. There are lots of options so that you can find what works best for you. These options include smart insulin pen, blood glucose meter, continuous glucose monitoring, also known as CGMs, insulin pumps, and CGM insulin pumps. One thing to note, any durable medical equipment over $500 will require prior authorization and review in order to be covered. CGM authorizations go through the pharmacy department. First up is the Smart Insulin Pen. It's a reusable injector pen, and it comes with a smartphone app to help you manage insulin delivery. It calculates and tracks doses. It provides reminders, alerts, and reports. It's available as an add-on to a current insulin pen or as a reusable form which uses pre-filled cartridges, so there are no vials or disposable pens. It's also affordable and easy to use. The biggest challenges for many insulin pen users are the dose amount, or how much to inject, dose timing, shelf life, temperature, and storage conditions, as well as insulin quality, also shelf life, temperature, and storage conditions. Next up is the blood glucose meter. For most people, a blood glucose meter is just a part of life. That's why getting it right matters. The two main types are standard blood glucose meters that use a drop of blood to check what your levels are at that moment, and continuous glucose monitors, also known as CGMs, that check your blood glucose regularly day or night. Pick the one that works best for you and your lifestyle. There are more choices than ever for blood glucose meters, from basic designs to more advanced models that have all the bells and whistles. Remember, fancier isn't necessarily better. Here are things to consider when choosing a blood glucose meter. Ease of use. Some meters are made for simpler operation, whether it's larger buttons, illuminated screens, or having audio capabilities. Then there's cost and insurance coverage. Meters vary in price, and some insurers limit coverage to specific models. Start by checking with your provider to find out what they'll cover. Then there's getting your information. Consider how the meter retrieves your information and whether you can download the data to a computer or a mobile device to make it easier to share with your diabetes care team. And finally, flexibility. If you're using a blood glucose meter and are tired of finger pricks, there's an alternative site monitor that lets you draw blood samples from your arm, thigh, or the palm of your hand. Next is continuous glucose monitoring. If you have type 1 or type 2 diabetes and just want to manage your blood glucose better, continuous glucose monitoring, or CGMs, may be right for you. CGMs work through a sensor placed on your skin. It transmits readings to a small recording device. Whether you manage your diabetes with a pump, daily injections, or oral medications, a CGM can help you manage your blood glucose. CGMs report your blood glucose levels in real time. For example, every 5 minutes throughout the day. It alerts you to when your blood glucose hits a high or a low limit, and it provides insight into glucose trends. Is CGM right for you? Many people with type 1 and type 2 diabetes can benefit from using CGM. Those that would benefit the most are people who have trouble reaching and maintaining target blood glucose levels. CGMs are particularly useful if you often have lows and are unaware of when those happen. This is called hypoglycemia unawareness. Even if you have good handle on your diabetes management, you may still want to consider using CGM for the convenience and the elimination of finger pricks. However, you'll want to keep in mind that if you are managing your diabetes well without the use of a CGM, your insurance may not cover it. They might consider it a non-necessity. Then there is the insulin pump. The important thing to know is that an insulin pump gives you options. You can get a pump, wear it for a time, decide to stop wearing it, and restart it if you think it will better fit with your treatment. Work with your insurance to match whatever works for you. Pumps are an extra piece of hardware attached to your body. They are programmed to deliver insulin continuously, also known as basal, or as a surge dose close to mealtime to control the rise in blood sugar after a meal. They work by closely mimicking your body's normal release of insulin. If your doctor determines that a pump is a good option for you, it's important to check with your insurance provider before you buy anything. Certain brands are covered by your benefit. In addition to cost, some things to consider when it comes to getting a pump are lifestyle and commitment. Talk with your doctor about the pros and cons of insulin pumps and if they may be a good fit for you. Remember, using a pump doesn't mean you no longer have to check your blood sugar. And it can take some getting used to, from setting it up and putting it in to managing it day to day. Make sure you've spoken with your diabetes care team about how to use your insulin pump correctly and how to check if it's working properly. And finally, a newer option to consider is using a combination CGM insulin pump. Your insulin pump will be able to integrate your glucose data from the CGM sensor and either suggest changes to insulin dosing or adjust the appropriate amount of background or basal insulin on its own. This is triggered when you run high, or when more insulin is needed, or when your blood sugar runs low. You need to use less insulin so that you don't have to think about it as much. Keep in mind, though, that you will still need to administer insulin for your meals. What does Highmark Health Options cover? As a reminder, some diabetes supplies are covered as part of your Highmark Health Options benefits. They include alcohol wipes, CGMs, insulin pumps, lancets, medications, replacement batteries, shoes or orthotics, syringes, and needles. To learn more about your Highmark Health Options benefits, you can review the information in the member handbook. You can view the highmarkhealthoptions.com website, or you can call member services at 1-844-325-6251 Monday through Friday from 8 a.m. to 8 p.m. And that brings us to the end of this topic. If you would like to learn more about the Health Awareness Series and watch more episodes, visit hho.fyi/HAS. Thank you for joining us. We'll see you soon.